I'm Greg Sobol, one of the orthopedic hand, wrist, and elbow surgeons with Michigan Orthopaedic Surgeons. I've been with this group, or one of the groups, for the last 15 years. I grew up in the area. I'm born and raised locally. Went to high school at De La Salle. Went to Michigan undergrad. Did my residency at Beaumont Med School at Wayne State. I was away a year for fellowship on the East Coast, and I've been happy to work in this area for the last 15 years. Most memorable experiences in my career have been from the volunteer work I've been able to do in Colombia. My first trip was when I was a fifth-year resident. I was fortunate enough to go down with some of the other staff, and one of the cases I remember specifically was a 4-year-old girl who had one of her legs unable to walk. She had a tibia that was broken since birth. We were able to do a surgery that time. We put a pin in it and fixed it with some bone graft. The issue with that is, we were there just for 1 week, but over the years I've been going for the last 15 years on these trips, I've watched this girl grow. We've been able to heal this bone, and she's like a near 20-year-old. She still follows up just to show us what a difference we've made, and it's just an extremely rewarding experience. We've helped many kids on these trips. Those are probably some of the more rewarding experiences I've had throughout my career on these mission trips. Currently, I'm really excited to see the changes that are going on, and excited to see what the future holds. Yesterday I was driving with my son in the car, and he was asking me about work, and he was asking me if he thinks when he grows up he's going to come to work with me. So that's, and I was trying to do the math. I was thinking that's going to be a few years down the road. I don't know if I'll still be working then, but we're growing right now as a group, and we have a lot to offer. We got a lot of great physicians in here. I'd be happy if he someday joins me. My daughters are interested as well. Sometimes don't like it when I give them some of the stories of some of the more involved traumatic cases I take care of, or some of the infections that we have to deal with. But they're definitely entertained, and they're also entertaining a career in medicine. So I think it'd be interesting to see what the future holds for our group, and maybe expand our practice. The local community is fortunate to have right here in this area surrounding both our offices and all the other offices that are part of MOS, some of the higher caliber orthopedic surgeons, representing almost every subspecialty of orthopedics. We have orthopedic surgeons that are fellowship trained in every subspecialty you need, and we'll be able to get you in to see one of these the same day or next day. That's our goal.